Angioplasty and stenting are two revolutionary procedures that have transformed the treatment of coronary artery disease. At the end of the video, see the alternatives to angioplasty, which are bypass surgery, and healthy lifestyle. Let's dive into the world of heart health and explore how these techniques work to improve blood flow and save lives. Imagine your coronary arteries as highways that supply blood to your heart. Sometimes, these highways can become clogged with plaque, slowing down traffic and putting your heart at risk. This is where angioplasty and stenting come to the rescue. Angioplasty is like a road widening project for your arteries. Here's how it works. First, a thin tube called a catheter is inserted into a blood vessel, usually in your arm or groin. This catheter is then guided to the blocked artery in your heart. At the tip of this catheter is a tiny balloon. When the balloon reaches the blockage, it's inflated, pressing the plaque against the artery walls and creating more room for blood to flow. Once the artery is widened, the balloon is deflated and removed. But wait, there's more. To keep this newly widened artery open, doctors often use a stent. A stent is a small mesh-like tube that acts like a scaffold to support the artery walls. Most stents these days are coated with medicine that helps prevent the artery from narrowing again. Now let's talk numbers. Coronary heart disease is a big deal. In the United States alone, 15.5 million people have this condition. It's responsible for nearly 1/3 of all deaths in people over 35. But there's good news. Thanks to procedures like angioplasty and stenting, mortality rates from heart disease have been declining over the past few decades. In 2021 to 2022, there were 132,000 coronary angiography procedures performed in U.S. hospitals. Men accounted for 67% of these procedures, while women made up 33%. These numbers show just how common and important these procedures have become in treating heart disease. But what happens after the procedure? Well, most patients experience a significant improvement in their symptoms. In fact, studies show that 92% of patients achieve what doctors call stabilization within 14 months after the initial procedure. This means they're free from major cardiac events like death, bypass surgery, or the need for repeat procedures. However, it's important to note that while angioplasty and stenting are highly effective, they're not a permanent fix. Over time, some patients may need additional treatments. About 15 to 20% of patients might need another procedure within 8 years. But don't worry, only about 1.7% of patients need more than 2 repeat procedures. Let's talk about what happens inside your arteries after stenting. It's quite fascinating. Research shows that there's a triphasic response. 1. In the first 6 months, there's an early restenosis phase where the artery might narrow a bit. 2. From 6 months to 3 years, there's a regression phase where the artery actually opens up a bit more. 3. Beyond 4 years, there's a late re-narrowing phase. This doesn't mean the stent isn't working, it's just the natural response of your body. Most people don't need any additional procedures. Now you might be wondering, is this procedure safe? The answer is yes, but like all medical procedures, there are some risks. The most common ones include bleeding or bruising at the catheter insertion site, allergic reactions to the dye used during the procedure, and in rare cases, damage to the artery. More serious complications are rare but can include heart attack, stroke, or the need for emergency bypass surgery. Your doctor will discuss these risks with you before the procedure. So, what can you expect if you need an angioplasty or stenting procedure? Here's a quick rundown. 1. You'll be awake during the procedure, but you'll be given medication to help you relax. 2. The procedure usually takes less than an hour. 3. You'll be connected to a heart monitor throughout the procedure. 4. After the procedure, you'll rest in a recovery area where your heart will be monitored. 5. You might feel some tenderness or soreness at the catheter insertion site, but this usually goes away within 2 weeks. 6. Most people can return home the same day or the next day, depending on their condition. After you go home, it's crucial to follow your doctor's instructions. This might include taking new medications, particularly blood thinners to prevent clots from forming in your stent. You'll also likely be referred to a cardiac rehabilitation program to help you recover and adopt heart-healthy lifestyle habits. It's worth noting that while angioplasty and stenting are incredibly effective, they're not the only treatments for coronary artery disease. Your doctor might also recommend medications, lifestyle changes, or in some cases bypass surgery. The best treatment plan depends on your individual situation. In the grand scheme of things, angioplasty and stenting have revolutionized the treatment of heart disease. They've given millions of people a new lease on life, allowing them to return to their normal activities with improved heart function and quality of life. But remember, prevention is always better than cure. Maintaining a healthy lifestyle with regular exercise, A balanced diet, not smoking, and managing stress can go a long way in keeping your heart healthy and your arteries clear. Do not forget to watch our video on screen about bypass surgery, which is an alternative to angioplasty and stent. Thank you for watching our video on angioplasty and stenting. We hope you found it informative and engaging. Stay heart healthy, and don't forget to subscribe for more health-related content.